Hypoglycemia. What is hypoglycemia? Recognition of hypoglycemia, and what steps can you take should you suspect somebody is having a hypo? 700 people a day get diagnosed with diabetes, and it's on the rise. Hypoglycemia literally means, if you were to translate it, hypo means low, glycemia means blood sugar. How are you going to recognize this? If it's a friend, a family, or a colleague, you get to know their character and you get to find out if they are not their normal selves. It can be extremely hard to find out if they're having a hypo if you don't know the person. But some of the most common things when somebody's having a hypo is that they can be extremely vacant. They might look as if they've had a lot of alcohol beverages and they're sort of falling, swaying. They may also be clammy and sweaty. They might be quite aggressive as well in some cases. If you see this happen to anybody, it's absolutely essential that you get sugar into them. We know that the word hypo means low. If you don't catch hypoglycemia quickly, then it could get very serious, very dangerous. They could go into a diabetic coma. They might have a diabetic seizure, but we want to prevent that from happening. So what could cause somebody to have an actual hypo? Here are some of the common things. 1, they may have taken too much medication and it drops it low. 2, they might not have had any food that day, which has dropped it really low. Maybe they're unwell, sickness, diarrhea, and that can also drop it down really low. I've got Edna here, and Edna, I suspect, is having a hypo because she is vacant. She's not herself. She's really quite ratty. So what I will do for Edna is make sure that they are seated. That's really important, just so that they don't fall down. Now, giving jelly babies is excellent for a suspected hypo. But the problem is with jelly babies, I wouldn't have these inside a first aid kit for the simple reason, when you go to get them, they'll be gone. People eat them. So this dextrose, now this is a really handy thing to have inside your first aid kit. You can give them a couple of these tablets, but I know Edna likes jelly babies. So Edna, listen, my lovely, I think you're having a hypo, so I'm going to get you to take 4 jelly babies for me, okay? Can you do that? Okay, so take one at a time. Okay, and just chew it. So we want them to take 4 jelly babies. This is the recommended amount by the professions, GPs, etc. After they've got the jelly babies inside of them, they will normally see that they will come back to themselves really quite quickly. Once you have got the jelly babies and they feel as if they've come out, they're back to their normal selves, they're feeling okay, we now need to treat. Why did our person actually have a hypo? Now, if it was because Edna hasn't eaten all day, we have to make sure that Edna now gets a substantial meal to keep her sugar levels up and to keep them happy. If Edna's taken too much medication, again, we need to make sure she gets a substantial meal to bring the sugar levels to a happy level and to keep her out of danger. Hypoglycemia. There are many different types of hypoglycemia, meaning the person could be diabetic type 1, they could have diabetes type 2, they may have another form of diabetes. There are a few other diabetics that can happen, let's say in pregnancy, for example. So always be mindful, have the tools to do the job. Make sure in your first aid kit at work that you've got dextrose, should something happening, or when you're at home, make sure you've got jelly babies or dextrose. Always be prepared. I'm Sarah and I am owner trainer of First Aid at Work, Aberdeen and Aberdeenshire, making training fun, engaging, but most importantly, memorable.